So the concepts are all the same. You've got to understand how ADCs work before you can understand the resistance pathways. So in my talk, I went through how ADCs work, and that was very enlightening to me, actually. So I learned loads preparing this talk, because this is not a topic that you would review every day. And really, the mechanisms of resistance that develop actually led how the next development of drugs has occurred and patient benefits. So, before we even try a new drug, we need to understand why something stopped working. So, for instance, in HER2-positive breast cancer, we had a drug called TDM1, and this is it was one of the first ADCs actually developed. And so an ADC, just to remind everybody, is an antibody then connected to a chemotherapy agent by a very novel linker, and this is the most difficult thing to design in ADC development, because we already have the antibodies and we have the chemotherapy, but putting them both together is a novel task. Now, ADCs are very important in delivering the very potency of chemotherapy into the cell, because you couldn't deliver that in conventional intravenous way. So delivering that amount of chemotherapy into the cell, and that's the whole point of the ADC, so antibody-drug conjugate. Now, looking at how resistance develops, one of the pathways of resistance development is that the receptor that you're trying to target changes in some way. It can disappear entirely, it can become mutated so that your ADC doesn't bind. Then the next level is internalization of that ADC. So what happens is, as it connects onto the surface of the cell, the molecule is internalized, and that linker that we talked about can be two ways. It can be cleavable or non-cleavable. Now, cleavable linkers are really the next generation of ADCs, and the reason for that is that chemotherapy is released into the cell, but it can permeate through the cell membrane into nearby cells, and this is something called the bystander effect. And though cancers may not necessarily express that particular receptor on the surface of the cells, they still get affected by the chemotherapy. So you could have a very heterogeneous tumor, i.e. not every cell has that receptor, but it will be affected by the ADC because of this bystander effect and how the chemotherapy permeates out of the cell into the cells nearby, which are not expressing that particular receptor. And that's a huge advance in drug design.